Today I will talk about aneurysmal bone cyst. Aneurysmal bone cyst, true to its name, is an expanding osteolytic lesion filled with blood. Aneurysm equals dilatation, distension. The condition is seen more commonly in young patients under 30 years of age. Most frequently involved bones are shafts of metaphyses of long bones, or the vertebral column. The radiographic appearance shows characteristic ballooned-out expansible lesion underneath the periosteum. Clinically, the aneurysmal bone cyst may enlarge over a period of years and produce pain, tenderness, and pathologic fracture. The pathogenesis is not clear, but it has been suggested by some authors that the condition probably arises from persistent local alteration in hemodynamics. Morphologic features. Grossly, the lesion consists of a large, hemorrhagic mass covered over by thinned-out reactive bone. Histologically, the cyst consists of blood-filled aneurysmal spaces of variable size, some of which are endothelium-lined. The spaces are separated by connective tissue, septa containing osteoid tissue, numerous osteoclasts like multinucleate, giant cells, and trabeculae of bone. The condition has to be distinguished histologically from giant cell tumor or osteoclastoma and telangiectatic osteosarcoma.